Hey everyone, this is Jason from Intricate Art Spine and Body Solutions. You can check us out at intricateartseminars.com. Remember, we teach 4 dry needling classes, 3 manipulation classes, and we offer an online dry needling class which talks about how to think about dry needling to use as far as treating the autonomic nervous system, right? So that's something that we're going to talk a lot about right here. So dry needling to reduce stress and anxiety combined with joint manipulation, right? So dry needling and joint manipulation to reduce stress and anxiety are 2 of the most powerful tools in all of medicine that we have to do such things, right? So vagus nerve stimulation in the ear, right? And the surgical procedure where they go in and they do like a little metal cuff around the vagus nerve. Both of those are FDA approved for anxiety, depression, epilepsy. Trigeminal nerve stimulation is approved for migraines, and it's being studied for a ton of other stuff like irritable bowel disease, chronic pain, all sorts of stuff. And the reason why vagus nerve stimulation has such widespread beneficial effects on the human body is because the vagus nerve is the primary nerve of the parasympathetic autonomic nervous system. And recent studies have estimated that 75% of all the parasympathetic fibers in our body are located within the vagus nerve itself. So the vagus nerve comes out of our brainstem. It's the 10th cranial nerve. It innervates almost all of our organs, right? Innervates our intestines, our liver, our heart, our lungs. So the vagus nerve innervates more distinct, different structures than any other nerve in our body, and it gets severely inhibited when the sympathetic autonomic nervous system becomes too hyperactive. So what happens with a lot of people is you get some initial life circumstance or mental trauma or physical trauma that starts to snowball into some type of either mental impairment or physical impairment, or almost all the time it's both, right? So if the sympathetic nervous system starts to go up, a bunch of things start to happen which are detrimental, right? Our tissues become hypoxic, our brain starts to produce more epinephrine, right? The locus coeruleus starts to produce more epinephrine. Our body stops producing as much GABA, which is a calming neuromodulator. It starts to produce too much glutamate, which is a stimulating neurotransmitter, neuromodulator, right? So pain goes up, and all of that stuff leads to anxiety and or depression and or stress. It just kind of depends on the individual's presentation of how they're going to present secondary to too much autonomic nervous system hyperactivity. But without question, it's going to cause detriments in your mental and your physical health. And 2 of the most common things that we deal with in medicine in general are anxiety and depression, right? So all the physical therapists listening to this out there will appreciate that it seems like a lot of our job is dealing with people's mental issues or outlooks, right? So you cannot separate the mind from the body. It's impossible, right? The mind keeps the score, the body keeps the score, however you want to think about it. You cannot separate mental impairment from physical impairment. This is one of the reasons why I think it's so devastating that mental health is in such a bad position in this country. And one of the primary reasons is we just don't have people thinking about these things the correct way, right? So I see incredibly powerful emotional releases and changes in people's mental outlook just in the short 3-day period when I'm teaching other doctors how to do dry needling and manipulation, or also throughout the time when I'm treating my patients during the week. I just see such dramatic and profound changes both mentally and physically with people because of the way that I treat the nervous system, right? So the best ways that physical therapists have to reduce anxiety and depression is to nudge the autonomic nervous system towards homeostasis as much as we can. So again, remember, just the act of living causes sympathetic autonomic activity. The vast majority of people, especially adults, are living with chronic sympathetic autonomic hyperactivity, which is going to depress the vagus nerve more than anything else in the body, because the vagus nerve is responsible for the parasympathetic autonomic nervous system. That's just how it works. Sympathetics go up, parasympathetics go down, and vice versa, right? So if the sympathetics are up too much and the vagus nerve is being inhibited, that inhibits the function of our brain, of our intestines, and as far as the brain and the intestines go, the intestines produce by weight 95% of the serotonin in our body. Now, we're not very sure about exactly how that's working in the intestines, but by weight, the intestines produce way more serotonin than the brain does, right? So we know that intestinal health, and there's lots of new studies coming out about this, we know that intestinal health is extremely important for mental health. And again, you cannot separate the mind from the body. So the best way that physical therapists have to specifically reverse that detrimental feedback process where it hurts more, you get more depressed, that releases more epinephrine and more glutamate, decreased GABA, decreased beta endorphin. One of the best external exogenous ways that we have to do that without medication, which is very important, and I think this is the most powerful way that we have in medicine right now to regulate the nervous system overall, is to directly target the parasympathetic autonomic nervous system with electrical dry needling, and to follow that up with joint manipulation in order to normalize the core of our body and to allow the brain and the body to do what they do best, which is allow us to live healthy, right? It's not that the brain and the body forget how to be healthy, it's that they become inhibited from doing so, because with enough tissue pathology and enough mental stress, all of these little things, every little tiny piece of tissue is detracting energy that your brain could and should be using to more properly regulate hormone imbalance, dopamine levels, serotonin levels, and all that stuff, right? So we know that the levels of a lot of the substances that we know have some effect on mental health get thrown out of whack when the sympathetic nervous system goes up, right? So in general, the stimulating stuff gets elevated, like epinephrine and cortisol. The relaxing stuff gets depressed, like beta endorphin, GABA, and some other things, right? So the best way, one of the best ways in all of medicine, I think, to help people recover from anxiety and depression is to treat the mind and the body as a single cohesive unit, right? So there's lots of psychotherapy that can be done. One of my favorites is EMDR therapy, right? I've had the best success with that. But aside from the psychological treatments, you're never going to properly or maximally improve somebody's state of anxiety and depression unless you treat their body with the express goal of depressing sympathetic autonomic nervous system hyperactivity, elevating parasympathetic activity, and inducing autonomic nervous system homeostasis. So the best way we have to do that as far as physical therapy goes, and again, I think in all of medicine, is to directly target the parasympathetic autonomic nervous system. So the best ways to do that, the most powerful treatment for the parasympathetic autonomic nervous system, is the only place in the body that we can directly treat the vagus nerve. So that would be the ear, right? So in the ear we have the concha, the symbiconcha, and the inside of the tragus, or the vagus. Typically the most common areas where the vagus nerve is distributed. Other great areas to target the parasympathetics, and for me personally, it's by far the most relaxing area to be needled, is in the pelvic floor. I know that sounds insane, you guys, but the physical feeling of being needled in the pelvic floor is very, very comfortable, and the neurophysiologic response that I get from it, I just feel my whole body relax, right, when I get pelvic floor needles, and I have that done a lot in the classes. So pelvic floor, upper cervical spine, right, the ear, so vagus nerve, upper cervical spine to also target the vagus nerve as it's exiting the foramen magnum, along with stimulating the trigeminal and the facial nerve, and sometimes books talk about the glossopharyngeal and the hypoglossal nerve as being parasympathetic as well. But one of the other areas that I really, really think is important to target for parasympathetic nerve stimulation is through this little fossa right in front of your TMJ. There's a big ganglion of the trigeminal nerve called the otic ganglion there. The mandibular branch of the trigeminal nerve, which is basically kind of innervates where my hands are, that's typically thought to be the most parasympathetic branch of the trigeminal nerve. And we know that the trigeminal cervical complex is a big problem causer with all sorts of things like loss of balance, anxiety, depression, dizziness, nausea, headaches, right? So the trigeminal cervical complex is a neural complex that starts with the trigeminocervical nucleus, which is in the dorsal horn of the spinal column right at C2, right? So let me grab the model here. So if we're thinking about the trigeminal cervical complex, here's C2 right there, right? So I got my finger on C2, here's the head, C1's in between. C1, 2 have by far the most movement of any joint in our spine, right? So C1 rotating on C2 has about 45 degrees of rotation in a normal spine. So I have about 90 degrees of cervical rotation to the left. 45 of those 90 degrees are coming from C1, 2. The other degrees are split between the other segments. So the next most segment behind C1, 2 only has like 13 or 15 degrees of motion. So the problem with that is that because C1, 2 is the most mobile joint in our spine, it's the easiest joint for our body to use to self-compensate for any other deviation anywhere else in our spine. So if we get lumbar deviation, remember the spine has coupled movements, so you can't side bend the spine without rotating the spine and vice versa. If the lumbar spine gets rotated, it's just mechanically easiest for our body to compensate at C1, 2. The problem is that when C2 gets deviated, C1, 2 gets deviated, the big muscles that attach there, like the middle scalene, the multifidus, some of the subcranial muscles, the inferior oblique, right? All of those muscles start to get abnormal stresses and strain placed through them. And some of the muscles that attach at C2, the afferent nerve, so the nerves going to the brain, cross right over that trigeminal cervical nucleus at C2 in the dorsal horn of the spinal column. When the trigeminal cervical nucleus gets aggravated, it starts to send aggravating afferent sympathetic signals up into the brain, right? So the nucleus is there, the neural network goes up into the brain through the brain stem and up into the cerebral cortex, right? So it helps regulate the bottom up and top down functions of our brain. If the sympathetics get too hyperactive and C1, 2 gets twisted out of place too much, it just becomes another detrimental feedback cycle where the muscles hurt, they get tighter, they pull C1, 2 out of place even more negative afferent stimulation crosses over that trigeminal cervical nucleus. And some scientists think that with enough negative afferents coming from the cervical musculature, since the afferents cross right on top of that trigeminal cervical nucleus, that's one of the theories for why people start to develop cervicogenic dizziness, is somehow enough of that negative afferents going across that nucleus short circuits it and it causes some type of dysfunction, right? Regardless of what exactly is going on, and we have a long way to go to figure that out, I see really, really positive, incredibly fast mental and physical improvements all the time when I'm treating people with dry needling. So as far as anxiety and depression goes, I think that dry needling should be a primary form of treatment, especially the parasympathetic dominant needling, but it should incorporate the whole body if you really want to get the best bang for your buck. It should be incorporated in all grade schools, right? It should be incorporated for adolescent stress and anxiety and depression, which is a huge problem nowadays. It's a medication-free, extremely powerful way to regulate the brain and the body towards neutral as far as the autonomic nervous system goes, which allows for widespread improvements in both physical and mental areas, right? So I would really strongly suggest that any parents that are watching this, get this to the athletic trainers at your school, any therapists, physical therapists, medical doctors, psychotherapists. I would love to help you guys get this implemented insofar as using it for mental health treatment. It's a really, really powerful treatment. It's very, very safe. There's no negative side effects, and it's very, very powerful. Thanks for listening. Let me know if anybody has any questions about anything.